Okay, the next section is the Plan, Do, Study, Act cycle. And the Plan, Do, Study, Act cycle, or the Pdsa, is used for many different problems and is used to come up with a plan of what to do with the problem that has been identified. And for the case study that I did, the first step is to plan, which would involve the developing and implementing a protocol for early recognition of patient deterioration. So this protocol would include specific parameters for vital signs and respiratory status that require prompt notification of the physician. And this plan would also involve the education and training of nursing staff, as well as ongoing monitoring and evaluation of the effectiveness. In the Do section of the Pdsa, the hospital would create a multidisciplinary team composed of nursing staff, respiratory therapists, and healthcare providers to develop protocol for early recognition of patient deterioration. The team would review the existing literature and evidence-based practice guidelines to determine the best way to implement the plan. Once the protocol is finalized, it would be presented to nursing staff during a mandatory education session. And the hospital will provide ongoing education and training to ensure that all nursing staff are familiar with the plan. For the study part of the plan, the hospital would evaluate its effectiveness by reviewing medical records of the patients admitted to the med-surg unit with respiratory illnesses, the number of patients who experienced a delay in recognition of deterioration would be compared to before the plan was implemented and to after. The hospital would also collect feedback from the nurses and healthcare providers to identify any areas that are needed for improvement or recommendations for future use. And the Do section of the cycle would be based on the evaluation from the nurses and the healthcare providers. So the hospital would need to make the necessary adjustments to the protocol to improve its effectiveness. There would need to be ongoing education and training to ensure that all nursing staff can recognize and are familiar with symptoms of deterioration. The results can then be shared with other healthcare facilities to improve patient outcomes in a similar setting. And then all these components are part of the cycle and they can change and influence one another.